It's 9:33 now. More Americans are dying of a drug overdose than ever before. It's according to the Centers for Disease Control and Prevention. And the cycle of addiction often begins at the doctor's office with a legitimate prescription for pain medication. Fox Medical Team's Beth Galvin joins us to talk about this trend that we really are seeing now. Beth, good morning.
And it's even more than a trend, Elise. I think it's really kind of becoming a public health emergency because we're seeing this epidemic of overdose deaths that has really just kind of exploded across the country. In 2016 alone, the CDC says 42,000 Americans died from a drug overdose, and 40% of those overdoses involved a prescription opioid. But now there's another, even more powerful drug in the mix, and it's even more deadly. Every day, about 115 Americans die from an opioid overdose. And the Centers for Disease Control and Prevention's Deputy Director, Dr. Ann Schuchat, says you can see the opioid crisis playing out in ERs across the country.
When we looked at emergency department visits last year, we saw they were 30% higher than the year before.
And Dr. Schuchat believes that jump in drug overdoses isn't more people becoming addicted. Instead, she says the drugs people are abusing are becoming more deadly, laced with the powerful synthetic opioid fentanyl. Used to treat severe pain, fentanyl is being illegally mixed into street drugs like heroin, intensifying the high and ratcheting up the danger.
Much of the drug supply, whether it's heroin or sometimes prescription drugs, or now cocaine and methamphetamine, has illicitly manufactured fentanyl in it that can be 50 times more potent and very, very lethal.
So Schuchat says the CDC is working with state public health departments, tracking overdoses, looking at what can be done to save lives, trying to expand access to medications that can reverse an overdose. But she says addiction often begins in the doctor's office with a patient who's hurting and a doctor who wants to help by writing a prescription.
Prescription lays the groundwork. Many people's first exposure to opioids or their pathway towards addiction begins with prescriptions.
So Dr. Schuchat says the CDC is pushing the healthcare community and the public to reconsider the risks of treating pain with a pill.
We want the public to be aware that a prescription opioid may not be the best idea for the problem that they have, and really trying to prevent people getting addicted in the first place.
And Dr. Schuchat says we're now on a very distinct third wave of overdose deaths. In about 2000, we started seeing a big jump in prescription opioid overdoses. Then about 2010, heroin took over as a leading killer, and now fentanyl is killing tens of thousands of Americans, and there's really no end in sight, Elise. So it's really something that, you know, we're struggling to sort of to get a hold of.
Yeah, no doubt about it. Some really disturbing numbers we're seeing with this. But if you have pain, how do you weigh the benefits against the risks of taking an opioid medication?
So, you know, that's a tough one, and I think that's a discussion with your doctor, because there are clear benefits of these pain medications. You know, number one, that they can help people who have mild to moderate to severe pain, but they also come with real side effect risks. They come with dependence risks. They come with addiction risks. So you need to talk to your doctor about, you know, what's the best course to treat my pain.
And the CDC has launched a prescription awareness campaign, is what they're calling it, at those considered highest risk. So who is it that they're trying to reach?
They're not trying to reach teenagers, as you'd expect. They're really trying to reach that group from about the age of 25 to 54. Those are folks who have probably already in their lives taken an opioid at some point. And there's, you know, the stats are showing and the research is showing a lot of people may be taking these pills when they don't necessarily need them, maybe misusing these medications. So really trying to get the word out to them about sort of the dangers of doing that.
I think we can all agree that something needs to be done.
Absolutely.
Yeah. All right, Beth, thank you.
Thank you.
Time is 9:37 now.